Alberta is proposing a major change to how some healthcare services could be delivered. New legislation known as Bill 11 would allow physicians to work in both the public system and in private clinics, a dual practice model that governments say could shorten wait times and expand access. As Alberta considers a dual practice model, allowing doctors to work publicly and privately, Calgarians shared varied reactions to whether they would pay for faster surgery.
Absolutely, I go privately.
Yeah? Why? Tell me why.
Because I can afford to go. I can afford it. Don't have to wait for it, right?
Bill 11 would require guardrails, including rules on how many procedures surgeons must complete in the public system before offering private surgeries. The Premier argues the model could increase surgical capacity without additional cost to taxpayers. But some Calgarians argue this isn't fixing the actual problem.
I believe in the premise of universal health care. If there are issues with the current system, they should fix it. I believe it's a staffing issue, a lack of resources. Setting up a two-tier system is not going to help the bulk of people who can't pay for these additional services. And we're not doing anything to address the capacity issue. That's the cause of the problem.
Some Calgarians raise ethical concerns about private options, pointing to how physician time and resources could shift away from patients waiting in the public system.
If I had the money and I went to private healthcare and took the time away from a doctor to help my case, there might be somebody else who needs it more at the time of. And I think that might be selfish. So even if I did have the money, it might be ethically a better choice to just stay in line.
The province says they remain committed to its public health guarantee that no Albertan will ever have to pay out of pocket to see their family doctor or to get the medical treatment they need. In Calgary, Hajar Al Khouzaii, City News.